As the global pandemic for COVID-19 is spreading very fast around the world and is wreaking havoc in states, uh, we are going to look at the case of Nigeria, which is the most populated country of Africa, one of the biggest countries in sub-Saharan Africa economically in terms of population. Currently, the projections and the data show that the rate of spread and infection around the world for COVID-19 is around 4 million people infected, and it has claimed 280,000 lives around the world. So the case for COVID-19 is not over, and many countries are bracing for the worst. And Africa, as one of the poorest continents around the world, with very populous slums around the countries, is very risky. So in this video we will look at the case of Nigeria. The first patient, or patient 0, emerged in Nigeria on February 27th. A 44-year-old Italian citizen was tested and diagnosed with COVID-19 in Lagos State. The case arrived through the airport, which basically is the main case of the spread in the beginning of the spread of the virus, in the Murtala Muhammad International Airport in Lagos, through a Turkish airline plane from Milan, Italy. Therefore, the Nigerian government took initial response to the issue, looking at the global situation with other countries and actually considering the risks for the country. So basically, the National Center for Disease Control, NCDC, started 4 main programs. The first one is EOC, EOC being Emergency Operations Center of the 3rd level. This is the highest level of emergency response in the country, one day after the first infection was revealed. Then in Lagos, which is the place in the city where the first infection is recorded, infectious disease hospitals are activated and put into place. Then the NCDC activates 2 rapid response teams in Lagos and in Ogun regions, which are neighboring regions, and they immediately start contact tracing to understand and see if the infectious person from Italian descent is actually being in contact with other people, and to try to find possible cases. This map shows the Nigerian map and its regions and the current status of the infection of COVID-19, which we could see that the most infected areas are in the northwest of the country, and the epicenter of the virus spreading in the country is actually Lagos and Ogun, which Lagos is the most populated city of the country. This graph is a direct illustration of how the case has been spreading. Cases have been spreading throughout the last 4 months, so from February 25th to May 9th, which is the most current data that we have from NCDC. So it seems that there is an exponential rise of cases in the country, especially on May 7th and 8th, and then there is its relative decline on May 9th. Currently, the number of cases in Nigeria are 4,151 total confirmed cases as of May 9th. 745 people have recovered totally, and 128 people have died from the virus. As one of the poorest countries around the world, although it has a rising nominal GDP as an emerging economy, this graph shows the medical capacity of the country for such pandemics, which actually puts it as a very risky stage. As compared to other sub-Saharan and African countries, Nigeria has only 5 hospital beds per 10,000 people, and it's a very limited number of seats. And if the cases were to rise exponentially, the country would have nothing to do in that sense. This graph shows the DW's projections based on the Imperial College's report on for lockdowns, and if nothing is done, the virus would claim, especially in Nigeria, 392,000 lives. However, the country is being very strict in its response and actually issued total lockdowns around the country for millions and millions of people, and the restrictions are enforced through military and security forces. This video shows actually how serious the Nigerian government have been to tackle any people who break social distancing and lockdowns. This shows the Nigerian police in Lagos disrupting people and arresting those who have opened their markets and businesses when the order for lockdowns have been put in place. So to understand the cases of Nigeria, we need to look at the fact that Nigeria and the Nigerian government have actually realized the fact that they are at a very high risk and they're not prepared. So the strict lockdowns seem to have been the most reasonable decisions to be made at that time. The number of cases in the country seemed slightly not as bad as it was projected. So the lockdowns seem to have been working, although the millions of people who are poor and they have lost their daily incomes when they work in these open markets put a high pressure on the government to reopen. Tests have been put in place, but it's relatively very low compared to the population of the country. The country has only done 34,000 tests so far since February, which is very low compared to the size of the population and the risk of the country. But then amid pressure and responding to the pressure of the public and poor people, actually there has been a strategy for reopening since May 4th in 3 stages. So the first stage is most essential businesses and markets will be open since then, and in the past 6 days we have seen a surge in number of cases. So the loosening of restrictions seems to be worsening the situation, but there is widespread debate. So what the government should do in that sense, and we believe, much like any other countries, the public pressure to reopen and people's economic burdens seem to override the risks of death and the disease. So this is our situation report of Nigeria and the cases of COVID-19 infection in the country.